Have you ever noticed your low back feeling tight for no reason, or your hips getting stiff after sitting for too long? Maybe you're in the gym and you feel like your glutes or your leg muscles just aren't firing the way they're supposed to, or even that your posture just feels off. A lot of people assume it's age related or that they just need to stretch more, but many times it's something called lower cross syndrome. So don't worry, lower cross syndrome, it's not a disease, but what it is, it's a postural pattern where certain muscles get overpowered or tight, and other muscles start to get really loose and weak. And this will start to pull your low back and your pelvis out of balance. So your hip flexors in the low back typically gets overworked and tight, while your glutes and your deep core stabilizers often get weaker and it's not working as well as you're supposed to. So this actually creates an posture imbalance, creates an arch in your low back, your pelvis starts to roll forward, and this puts constant strain on your lumbar spine, which makes everyday movements harder than they need to be. People with lower cross syndrome in my office, they often describe the same kind of cluster of symptoms: tightness across the low back, stiffness after sitting or standing for a long time, tight hip flexors, and these glutes that feel weak or just asleep, and then always have hamstring tightness and discomfort when bending, squatting, lifting, tying their shoes, so on and so forth. Um, these symptoms usually come from when the body is trying to compensate for some sort of pelvic or lumbar imbalance. Now, the great news is chiropractic care can help. When the joints of the lumbar spine, the sacrum, and the pelvis aren't moving correctly, the muscles around them, they can't work the way they're supposed to. So chiropractic adjustments help restore proper motion in the pelvis, which helps calm down irritated nerves and allows the glutes and the core to re-engage and build some strength and stability. Once the foundation's moving correctly, we start to pair the adjustments with specific corrective exercises to strengthen the weak muscles and to lengthen or stretch the tight ones. This combination gives your body a new pattern to follow, one that's more stable, strong, and balanced. So if lower cross syndrome it's not corrected, it's left uncorrected, this can start to lead to recurring low back pain, disc irritation, hip problems, early degeneration, and decreased performance in almost any physical activity. The pelvis is your base, it's your foundation. And so if this shifts and it's off, everything above and below starts to compensate. The good news is your body can adapt really quickly with the right approach. When we improve the alignment and the muscle balance, most people start to notice they move easier, they feel stronger, and they aren't fighting that constant tightness anymore. So if you're dealing with low back tension, some hip stiffness, or pain in your pelvis, or you feel like your muscles just aren't firing properly like in the gym or supporting you the way you should, it's worth getting checked. Lower cross syndrome is incredibly common, but it's very fixable with the right plan. If you're ready to get evaluated, our scheduling link's in our bio, or you can send me a message and I'll get back to you as soon as possible. We will gladly take a look at your posture, your pelvis, your movement, and get you feeling and functioning at your best.